Look, insurance sucks. I'll just make it suck less.
What's going on, guys? It's Brad Hannon. Just like last week, we talked about the health matching account. Today, I've got another plan, another acronym for you as well. PHP, the Partnership Health Plan. Listen, if these videos, if these little trainings, these little product trainings, or anything that we put out on the channel helps you, brings you value, do me a huge favor. Hit the subscribe button, like this video, maybe even drop a comment. Who knows, get real crazy, drop a comment, and turn on post notifications. We've got probably 5 more products that we're going to cover, just like health matching account, just like partnership health plan, and some of the other products that we mentioned on the webinar that we did a couple weeks ago. If you missed that webinar, the full video is going to be in the description, so feel free to check that out. This is more of a deep dive, a deeper dive into each and every one of these products. Today, we're talking about Partnership Health Plan, okay? This plan is administered by S&S Health. That is the TPA, right? The third-party administrator. They've got tons of experience, right? This is the team behind essentially getting claims paid. So we love that it's backed by S&S Health. It's underwritten by Providence Insurance Company, if you ever had any questions there. But S&S Health, been around for a while. Providence, been around for a while. I want to walk you through some of the benefits, but before I do, kind of take you on the customer journey, how the plan works. It's important to know, first of all, that the plan is only available for first of the month effective date. So if I were to write a plan today, today is the beginning of April, April 4th. If I was to write a plan today, that plan would be effective on May 1st, right? We've got to get the plans written before the 15th of the month to have a first of the following month effective date. So your client is going to get the welcome materials, okay? Obviously cards, things like that, mailed to them, right? The welcome material is going to be provided to the member. The member can then connect with a concierge that can help find providers, or you can look up providers through the multi-plan PHCS practitioner and ancillary network. So for outpatient services, doctor's visits, specialists, for outpatient visits, it utilizes the PHCS practitioner and ancillary. Okay. It is a pretty wide network. We do find plenty of doctors in that network. So utilizing a network, outpatient, inpatient, it's going to utilize value-based or reference-based pricing, just as you see here, right? So there is pre-certification required for any non-emergency, right? Outpatient surgery. You do have to get it pre-certified, or the client would have to get it pre-certified. Medical services rendered, submitted to the TPA based on reference-based pricing. Payments are made very seldomly. Okay, it's important to note that it can happen, but very seldomly. Okay, I think they say under 2% of the clients on this plan get balance billed. Okay, so there is always, as any plan that uses reference-based pricing, there's always a chance that they could be balance billed, or your client could be balance billed. With this particular plan, it doesn't happen very often. Okay, but it's worth noting. Okay, the other thing that's worth noting is that they do have limited benefits. As we get into talking about the benefits, they do have limited benefits for the days in the hospitalization. But we'll talk about that. I'm going to skip over the MEC plans. If you've been selling insurance for any length of time, you get the point, right? MEC plans cover preventative and wellness. The MEC plans don't have any outpatient or inpatient benefits. So if there was anything big that happened, a MEC plan's really not going to do you any good. But the MVP plans, okay, the MVP bronze, silver, and gold, they do have outpatient and inpatient alike. They do cover some mental health. They do have prescription coverage. It's important to note, no specialty RXs, so no specialty prescriptions. Let me zoom in here a little bit to the benefits. One of the first things that you'll notice, right, is that this plan has zero deductible. Okay, it is a zero deductible true copay plan. Okay, $25 copay for a primary care visit, $50 for a specialist on the bronze, and then you can see $15 for silver and gold, $25 for specialists on the silver and gold. But here's the really important thing, and you can see kind of the limitations as far as the 10 doctor's visits or 8 doctor's visits. But what's also important is the hospitalization. So inpatient, okay, it's only going to cover 5 days in the hospital. Okay, silver, going to cover 7 days in the hospital. Gold, it's going to cover 10 days in the hospital. You might think, well, what good does it do if it's only going to cover 10 days or if it's only going to cover 7 days? Guys, we are not trying to sell this plan to everybody, right? Everybody is not a fit for this plan, okay? Nothing we ever talk about usually is, right? There is no one size fits all. As a broker, right, or as somebody that has the ability to offer many different options, right? This is just another one of the tools in your tool belt, right? This is a guaranteed issue plan with coverage for pre-existing conditions, okay, that you can sell year round. I'll let you fill in the blanks, okay? There's a million different fits for the plan, but it doesn't mean that it's for everybody. So if I'm talking to somebody with a major medical, not paying a whole lot, pretty happy with it, no real complaints, I'm not trying to switch them onto a plan that does have a few more limitations, okay? But it will cover maternity. It will cover pre-existing. It is guaranteed issue. It does have prescription coverage. It is all copays with a true maximum out of pocket. Okay, the only real way you're going to hit this maximum amount of pocket is through the copays. So it's going to be really, really hard to hit that max out of pocket, but you could do it in theory. And like I mentioned before, balance billing, still possible. Okay, also still possible that your client goes to the hospital for more than 10 days. Okay, but if you came across that client and they had no insurance and we put them on that, at least 10 days in the hospital would be covered. And I don't have the statistics. I can probably Google it in a quick second, but you could too, as far as how many hospitalizations are resolved within 10 days or resolved within 7 days. We're covering a lot of their risk. We're not covering it all. Okay. This is a group plan through a limited partnership with Global Data. I think you can read a little bit about that. No, maybe not. There's some material about that somewhere, but this is a partnership through Global Data Group. It's a limited partnership, so it's basically an ERISA-based group plan that your client will have access through joining that Global Data Group. Okay, the MVP Bronze, Silver, and Gold are actually metal rated, so it's not just a name for the plan; they actually are metal rated off of the ACA. And I'll send this brochure to anybody that reaches out. If you need marketing material or you're interested in more marketing material, shoot me an email at bhannon. So that's BHANNON at myHST. Happy to answer any more questions you have, as well as get you contracted if you wanted to offer this. One of the most common, one of the best things about this plan is you see the $350 copay for childbirth, as well as the $350 copay for outpatient hospitalization. A great benefit for somebody that maybe doesn't have insurance and gets pregnant mid-year, right? It is important to say, we don't only want to sell it in those situations, right? We want to sell this plan to healthy individuals that are looking for options like this as well. If we just pile all of our unhealthy, pre-existing, pregnant clients on a plan like this, the plan quickly goes away. Right. So we've got to be smart with it. And we don't want to buy claims. Right. So we're not in the business of buying claims and losing money, or the carrier will stop offering the plan. So I want to go through some of the enrollment steps with you, at least show you what that looks like. But here's some of the additional benefits. 100% of the wellness that you'd have on an ACA plan covered on this plan. Inpatient, outpatient. One of the gaps, one of the holes in this plan, along with the limitations as far as the days in the hospital or the days in the ER or whatnot, is the cancer coverage, right? So chemo, radiation. If somewhere, let's see, there's not a whole lot of coverage for chemo, radiation. It does limit that, so it's best sold with a nice cancer plan along with it. I don't see where it's actually broken down, but I know that there is some limitations. It may be actually down in the exclusions and things. But here's what I was looking for as far as gaining access through joining Global Data Group. So you become a member of the Global Data Group limited partnership, 100% free. You sign the company's joinder agreement, and now you have access to the benefits through that joinder agreement. Definitely helpful. The bronze plan you see doesn't give you copays for the brand name drugs and beyond. I don't sell a whole lot of the bronze plan. Typically, it is either the silver or the gold. Okay, keep in mind, again, we're not selling the plan to everyone. It's just one of those situations that are one of those plans that definitely helps in the in the situation where you have somebody that has pre-X and maybe they have pre-existing conditions and they don't have coverage, or they're losing their coverage, or whatever the case may be. So this is the benefits portal. I just want to go through an enrollment with you real quick. All you would do here is you'd plug in your email, your name. You would plug in the client's email, name. You would create a password for them, and you would plug in your six-digit agent ID. Okay, if you don't have a six-digit agent ID, reach out to me. We'll get you contracted, up and running to sell the policy. But this is creating a member portal. Okay. The reason why I'm going through this is because some of you guys may already be contracted. You may be looking at this video for a little bit more training. There's one important thing, or really two important things that I want to point out. The one I already did. This is creating yourself an account. Okay. There is no quoting. All of the rates, which we didn't cover, all of the rates are right here. Okay. 500 essentially for the bronze, 555 for the silver, 600 for the gold. That is for a single. But also you've got employee plus spouse, employee plus children, and family plans ranging from 1,000 to 1,300. So really still cost effective when compared to an ACA plan with no subsidy. But there's no quoting, guys. This is the rates, right? It's composite rated, meaning there is no age doesn't matter. So yes, for somebody that's 26, probably not looking to pay $555 may not be a fit, right? But for somebody that's 60 and not yet on Medicare, may be a great fit. Okay, $555 for silver. It's kind of right in that sweet spot where it's good for you because you're making commission on the premium, but also good for the client to where they can afford it and they've got really good benefits. Remember, 0 deductible and all copays. This is the client benefit portal. So when you sign them up, you're putting their information in here. And then the second thing that's really important to know is if you're using a bank draft, okay, the company is going to make 2 small deposits, 2 small transactions in the account holder's account that will have to be verified. Okay, so you'll have to get those amounts and verify it inside of the portal. Otherwise, their policy will never be effectuated. But with a credit card, they don't have to do that. So I just point this out because a lot of people pull up to this or get to this and they will plug their own email address in like they're creating a broker account. This is actually for a client. You're proceeding right into the enrollment to get the client on this particular plan. Okay. In addition to, and I don't have it pulled up on my browser, so I can't really show you, but in addition to this, there is a brochure or a summary of benefits, if you will, for bronze, for the silver, and for the gold. Again, reach out to me. I'll be happy to email you these things. I can't pull it up right now for the training, but bronze, silver, and gold each come with a list of exclusions. Essentially, if it's not an exclusion, you would have coverage. I can tell you some of the exclusions, some of the big ones to watch out for would be something like, NICU, right? So newborn ICU, not going to be covered, right? Again, not ideal, but we're not selling this to everybody. Okay. I had somebody reach out to me. She was very worried. Are you sure this plan is legitimate? Is it going to work for my client? I've got a client that's pregnant and, so on and so forth. My first question is very simple. Do they have coverage now? No. Do they have a special enrollment period? No. Do you know of another plan that you can put a already pregnant woman on? No. Well, it's the best available option then, right? And that's what we've got to remind ourselves of. That's what we've got to remind the client of. Typically, somebody being sold this policy is in a little bit of a tough spot. But remember, we don't only want to sell it to those individuals. I do have plenty of healthy individuals on this plan as well because they're looking for something that has copays for doctors, that has preventative and wellness, that has prescription drug coverage. They may be healthy, but they still want all those things. Again, a great fit. Also worth noting that you do not have to be licensed in the state that you're selling it because it is a group plan and it's based out of Georgia. You can sell it in any state. It's available in all 50 states. So we utilize it a lot in the states where, we have a travel healthcare worker in California and they don't have any other options, or Maryland, or, these states where short-term medical might be limited, or options outside of the ACA may be limited as a whole, right? So another important thing to Another important thing to keep in mind. So that's a quick high-level overview of the partnership health plan. I'm happy to answer any questions that you might have. Again, get you contracted, get you up and running to be able to offer this plan. Shoot me an email, respond here, drop a comment. My email again, bhannon@myhst.com, and look forward to helping you out.
I'm a health insurance hustler. Bradley Hannon's the name. I'm here to teach these agents